Today we will try to learn about the classification of oral antidiabetic drugs. In this video we are categorizing it according to their mechanism of actions. So there is 6 categories of oral antidiabetic drugs, that is insulin secretagogues, insulin sensitizers, alpha glucosidase inhibitors, incretin mimetics, SGLT2 inhibitors, and some other agents. First, the insulin secretagogues. It exerts anti-diabetic effects by increased insulin release. There are 2 groups of insulin secretagogues, sulfonylureas and non-sulfonylureas. Sulfonylureas can be first generation and second generation. First generations are tolbutamide, chlorpropamide, and tolazamide. These are not used these days. We use the second generations. Second generation sulfonylureas are glibenclamide, glipizide, gliclazide, glimepiride. Non-sulfonylureas includes meglitinides, examples is repaglinide, and diphenylalanine derivatives. The example is nataglinide. Now there is insulin sensitizers. There's 2 groups, that is biguanides and thiazolidinediones. Biguanides includes metformin and thiazolidinediones has pioglitazone, rosiglitazone, etc. Now there is alpha glucosidase inhibitors. It exerts antidiabetic effects by retard carbohydrate absorption. The examples are acarbose, miglitol, and voglibose. Now there is incretin mimetics. Incretin mimetics can be DPP4 inhibitors and GLP-1 analog. DPP4 means dipeptidyl peptidase 4 inhibitors. GLP-1 analog means glucagon-like peptide 1 analog. The examples of DPP4 inhibitors are sitagliptin, vitagliptin, and linagliptin. And the example of GLP-1 analog are exenatide and liraglutide. Number 5 is SGLT2 inhibitors. SGLT2 inhibitors, the elaboration is sodium glucose cotrans 2 inhibitors. Examples are dapagliflozin, canagliflozin, and empagliflozin. And there are some other agents that are nice to know. One is dopamine 2 agonist, example is bromocriptine, and 2 bile acid sequestrants, example is colsavelum. There is another classification where we can see which antidiabetic drugs can cause hypoglycemia and which doesn't cause any hypoglycemia. First, the drugs causes hypoglycemia is parenteral insulin preparations, and in the oral hypoglycemic agents there is sulfonylureas and meglitinides. We learned the examples in previous slides. And drugs that doesn't cause hypoglycemia or that has glycemic effects are biguanides, thiazolidinediones, alpha glucosidase inhibitors, and incretin mimetics. Thank you.